Military medics and interstate nurses are being rushed into aged care homes in Victoria amid a growing health crisis that is disproportionately affecting the vulnerable elderly. The urgent action is being taken after Premier Daniel Andrews said he no longer had confidence in a number of private nursing homes to provide adequate care. 4 of the 6 COVID-19 deaths recorded yesterday were linked to aged care homes, and outbreaks are continuing to grow, with a jump of 19 cases at a nursing home in Kilsyth in the city's outer east. Abattoirs are also a key hotspot.
And in Sydney, health authorities have ramped up their alert for people who visited Potts Point in the past few weeks after confirming a link between outbreaks at 2 restaurants and the nearby Cruising Yacht Club of Australia. Stephanie Ferrier is in Melbourne and Lily Mayers is in Potts Point. Steph, I want to start with you because we know that the Defence Force personnel are being sent in to help with the situation in Victoria, but what are the details about it all?
Yes, good morning, Lisa. The Australian Defence Force medics are coming in to help provide that really crucial support here for aged care homes. Some 80 or so aged care homes that are now affected with this COVID-19 outbreak. And that includes nurses to try to help provide that support, as well as move some of these residents to hospitals for further needed medical care, as well as the Australian Medical Assistance Teams, or AUSMAT teams, that will come in now. The Health Minister, Greg Hunt, has described those teams as the SAS of the medical world and says that they're the very best of the best to try and help. They've already done a lot in terms of quarantine and been sent over to Western Australia as well. So they have quite a few runs on the board to be able to help in this aged care sector. And they're also going to provide more than 5 million masks and face shields from the National Medical Stockpile for the aged care sector here.
And Steph, there are emerging tensions between state and federal leaders over the handling of Victoria's aged care situation. What's happened there?
Yes, well, both the Premier, Daniel Andrews, and Greg Hunt, the Health Minister from the Commonwealth, haven't been mincing their words at all when it comes to this very vexed issue of the COVID outbreak amongst aged care homes. And the Premier, Daniel Andrews, said yesterday that he couldn't have any confidence at all that staff or management at some of these private aged care homes could provide the adequate care to keep residents safe. In fact, he said that some of the stories that we've heard have been simply unacceptable, and he wouldn't want his mother in some of these places like this. Now, Greg Hunt very quickly shot back that that was a very dangerous statement to be making about the efforts of what he called the wonderful human beings that are the staffing nursing care, because he had one of his parents who was actually helped before his death in an aged care home as well. So when he was asked, but this is what the Premier said, he straight away said, I will not stand for this sort of talk like this about the aged care staff. So that's certainly come up. But of course, this is where the situation lies with the private aged care sector, because they are regulated by the Commonwealth. And of the 769 active cases in aged care homes, just about all of them fall into the private sector. Now, that also includes, of course, what we've just heard earlier, the sad fact that there are 6 deaths yesterday, and 4 of them were related to these aged care homes and these private aged care homes. Now, the Premier says despite all of this, he doesn't want to get into a blame game, and he says quite pointedly that he is responding to the Commonwealth's call for help. So he has decided to cancel all but the most urgent of elective surgeries across metropolitan Melbourne, so that will free up really importantly needed nursing staff to be able to come into places like St Basil's here at the Home for the Aged here in Fawkner in Melbourne's north. They've already sent some of those registered nurses teams in here to help with the residents that do remain, and that's where most of the efforts from our healthcare system will be pointing towards aged care rather than any surgeries on the table.
Okay, thanks, Steph. And Lily, in Sydney there, the numbers are growing at that Apollo restaurant, and they have got a link. Tell us about this.
Well, Lisa, it's understood a couple dined at the Thai Rock restaurant in Potts Point and days later here at the Apollo restaurant before testing positive to COVID-19 yesterday. And New South Wales Health believe this is what links the suburbs to outbreaks. The two people had also visited the Cruising Yacht Club of Australia at Rushcutters Bay, which has now been closed for a deep clean. And given the growing number of cases in this suburb, a new testing clinic will today open from midday at Rushcutters Bay Park, and another testing will continue at a pop-up clinic in Surrey Hills. Health say anyone who lives here in Potts Point or has visited the area in the last 2 weeks has got to keep an eye out for any symptoms developing and get tested if they do.
And Queenslanders are being told not to travel south. What's going on? Are we going to have another stoush over the borders, Lily?
Well, that's yet to be seen. The Queensland Premier Anastasia Palaszczuk has urged Queenslanders not to travel to New South Wales, but she says Queenslanders shouldn't be leaving Queensland at all. She says the government there is closely monitoring community transmission here in Sydney.
All right, thanks Lily and Steph. Good to have all those details. We'll touch base with you if there are developments during the program. Now let's just recap on that breaking news you can see across the bottom of your screen. And a private school at Logan, south of Brisbane, has been closed after an employee tested positive for coronavirus. Queensland Health says the woman tested positive yesterday after returning from interstate last week. Contact tracing is underway and the school is closed until further notice for cleaning. Mayors of Australia's capital cities are calling for a $200 million social housing fund to be established to help deal with an expected deluge in homelessness. They say the response to the COVID crisis shows the problem can be solved. Since the pandemic hit, most rough sleepers have had a roof over their heads thanks to a combination of programs.
South Australia's stronger border controls with Victoria have come into effect overnight. It now means SA residents who are still in Victoria won't be able to cross into their home state. There are some exemptions, though, for essential travellers and for compassionate reasons.
Well, let's get more on the stricter border rules that have been brought in South Australia this morning, barring all travellers from Victoria, including SA residents. Brittany Evans is in a very chilly-looking border town in South Australia. Good morning, Brittany. Good that you're all rugged up there. Now, what is the situation? This all happened at midnight, didn't it? And we saw the rush of everyone trying to get across the border, including one of our own producers who is now in quarantine in Adelaide.
Yes, good morning, Lisa. You're right, it's very, very chilly here, and I don't know whether it's the cold or whether everyone's just gotten the message that they can't cross into South Australia this morning. Since last night, at about 7 o'clock, police say that there was a really steady decline, but since 12 o'clock, midnight here, when the rules came into place that no one can cross into South Australia, there have been no cars. So it seems like everyone from Victoria has gotten the message and got across yesterday, and that certainly was the case with the number of cars that we saw. There would have been hundreds of people crossing into South Australia. Yesterday afternoon, there was a steady flow of cars for most of the day. At one point, there was up to an hour wait to get into the state, but that slowly dropped off as the day went past. People were coming into the state for many different reasons. Some had lost their jobs over in Melbourne and were coming back to South Australia to get employment or to just seek that help from their family members. Others had family members on board and were taking them across to get medical treatment. So there are a number of different reasons, but as you can see, it's a lot quieter at the moment.
How are the border communities there coping with these restrictions?
Look, Lisa, it's been quite difficult for those communities. There has been a lot of changes and a lot of uncertainty, but there have been a number of border community members who have been crossing back and forth that we spoke to yesterday, some that have work, some that need food and medical supplies. So there is those new restrictions that has been brought in. So it's important to note that now border communities can only come into the state if they're staying within 40 kilometres. So there's been that 40 kilometre radius put on both South Australians and Victorians wanting to pass the border. So there is that change come in. Previously, it was up to 50 kilometres for border communities. So there is that special exemption for them, but it is still obviously a difficult time, seeing as there always has been that easy flow to come across to either state.
Yeah, we had the Premier on the program yesterday, Stephen Marshall, and he was talking about just how important he felt it was to keep the numbers negligible in South Australia. And then, a couple of hours later, we discovered that there actually was a new case, and that was someone coming from Victoria. Remind me of the details.
Yeah, that's exactly right, Lisa. So we found out yesterday afternoon that a woman in her 20s has tested positive. So she crossed the border from Victoria. She was travelling with her family. She's a 20-year-old woman, and she was coming into South Australia actually to get a new job. So she had got that all lined up and was coming across the state to and had been in quarantine. So she was coming across to prepare to get ready for that job, but then tested positive on Saturday. So that's exactly the kind of situation that South Australian authorities are trying to avoid. Although it is important to get some people across the border, they're hoping to really curtail that number that we're seeing in Victoria and hope that that won't happen here in South Australia.